Good morning. Today our discussion is about post-traumatic stress disorder. Post-traumatic stress disorder is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic event may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day-to-day functioning, this may be a post-traumatic stress disorder, PTSD. Who gets the PTSD? Anyone can develop PTSD at any age. This includes combat veterans and people who have experienced or witnessed physical assault, abuse, accident, disaster, or other serious event. People who have PTSD may feel stressed, frightened, and even when they are not in a danger. Not everyone with PTSD have been through a dangerous event. Sometimes learning that a friend or a family member experienced a trauma can cause PTSD. According to the National Center for PTSD, a program of U.S. Department of Veterans Affairs, about 6 out of 100 will experience PTSD at some point in their lives. Women are more likely to develop PTSD than men. Certain aspects of traumatic event and some biological factors, such as genes, may make some people more likely to develop PTSD. Signs and symptoms. The symptoms of PTSD begins within 3 months of the traumatic event, but they sometimes emerge later. To meet the criteria for PTSD, a person must have symptoms for longer than a month, and the symptoms must be severe enough to interfere with the aspects of daily life, such as relationship or work. The symptoms must be unrelated to medication, substance abuse, or other illnesses. The course of the disorder varies. Some people recover within 6 months, while others have symptoms that last for 1 year or longer. People with PTSD often have co-occurring conditions such as depression, substance abuse, or one or more anxiety disorder. After a dangerous event, it is natural to have some symptoms. For example, people may feel detached from the experience, as though they are observing things rather than experiencing them. A psychologist or a clinical social worker can determine whether symptoms meet criteria of PTSD. To be diagnosed with PTSD, an adult must have all the following for at least 1 month: at least one re-experiencing symptom, at least one avoidance symptoms, at least 2 arousal reactivity symptoms, at least 2 cognition and mood symptoms. Re-experiencing symptoms, the experiencing flashback, reliving a traumatic event, include physical symptoms such as racing heart and sweating, having recurring memory or dreams related to the event, having distressing thoughts, experiencing physical signs of stress. Thoughts and feelings can trigger these symptoms, as can words, objects, situations that are a reminder of the event. Avoidance symptoms include staying away from places, events, or objects that are a reminder of the traumatic experience, avoiding thoughts or feelings related to the traumatic event. Avoidance symptoms may cause people to change their routine. For example, some people may avoid driving or riding in a car after a serious car accident. Arousal and reactivity symptoms include being startled, feeling tense, on guard, or on the edge, having difficulty concentrating, having difficulty falling asleep or staying asleep, feeling irritable, and having angry or aggressive outbursts. engaging in risky, reckless, destructive behavior. Arousal symptoms are often constant. They can lead to feeling of stress and anger and may interfere with parts of the daily life such as sleeping, eating, concentrating. Having trouble, cognition and mood symptoms include having trouble remembering key features of traumatic event, having negative thoughts about oneself or the world, having exaggerated feeling of a blame directed toward oneself or other, having ongoing negative emotion such as fear, anger, guilt, shame, losing interest in enjoyable activity, having feeling of social isolation, having difficulty feeling positive emotions such as happiness or satisfaction. Cognition and mood symptoms can begin or worsen after a traumatic event. They can lead a person to feel detached from friend or family member. How do the children and teens react to trauma? Children and teens have extreme reaction to trauma, but some of their symptoms may not be the same as those in adults. In children younger than 6 years, these symptoms include wetting the bed after having learned to use the toilet, forgetting how to talk or being unable to talk, acting out the scary event during playtime, being unusually clingy with a parent or adult. Other children and teens usually show symptoms more like those seen in adults. They also may develop destructive, disrespectful, destructive behavior. Older children and teens may feel guilty for not preventing the injury or death. They may also have thoughts of revenge. The risk factor for PTSD: not everyone who lives through dangerous environment develops PTSD. Many factors play a part. Some of these factors are present before the trauma. Others become important during or after the traumatic event. Risk factors may increase the likelihood of developing PTSD include being exposed to previous traumatic experience, particularly during childhood, getting hurt or seeing people hurt or killed, horror, hopelessness, extreme fear, having little or no social support after the event, dealing with extra stress feeling for the event, such as loss of loved one, pain, injury, and loss of job, having a personal or family history of mental illness or substance abuse. Resilience factor that may reduce the likelihood and learning from traumatic event, being prepared and able to respond to upsetting events as they occur, despite feeling fear of development of PTSD, include seeking help and support from professional support group, family, learning to feel okay with one's action in response to traumatic event, having coping strategy for getting through. The treatment: it is important that anyone with PTSD symptoms to work with a mental health professional who has experienced treating PTSD. The main treatment are psychotherapy, medication, combination of both. A mental health professional can help people find the best treatment plan for their symptoms and need. Some people with PTSD, such as those in abusive relationship, may be living through ongoing trauma. In these cases, treatment is usually most effective when it addresses both traumatic situation and the symptoms of PTSD. People who experience traumatic event or who have PTSD may also experience panic disorder, depression, substance abuse, and suicidal thought. Treatment of these conditions can help with recovery after trauma. Research shows that support from family and friends can be an important part in the recovery. Psychotherapy. Psychotherapy, sometimes called talk therapy include variety of treatment techniques that mental health professionals use to help identify and change troubling emotion, thoughts, and behavior. Psychotherapy can provide support, education, guidance to people with PTSD and their families. Treatment can place one-on-one or in a group, usually lasts for 6 to 12 weeks, but might last longer. Some types of psychotherapy target PTSD symptoms, while others focus on social, family, job-related problems. Effective psychotherapy often emphasizes few key components, including learning skills to help identify triggers and manage symptoms. One common type of psychotherapy includes cognitive behavioral therapy and can include exposure therapy and cognitive restructuring. Exposure therapy helps people learn to manage their fear by gradually exposing them in a safe way to the trauma that they experience. As part of exposure therapy, people may think or write about the trauma or visit the place where the trauma has happened. This therapy can help people with PTSD to reduce symptoms that causes them distress. Cognitive restructuring therapy helps people make sense of the traumatic event. Sometimes people remember event differently from how it happened. They may feel guilt or shame about something that is not their fault. Cognitive restructuring can help people with PTSD think about what happened in a realistic way. Then we go to medication. The U.S. Food and Drug Administration approved SSRI, type of antidepressant medication for the treatment of PTSD, and it helps with the symptoms, such as sadness, worry, anger, feeling emotionally numb. Health care provider may prescribe the SSRI or other medication along with psychotherapy. Some medication may help to treat specifically PTSD symptoms like sleep problem and nightmares. People should work with their health care provider to find the best medication or combination of medication at the right dose. To find the latest information about the medication, talk to your health care provider and visit the FDA website. How can I help for PTSD? If you are not sure where to get help, healthcare provider can refer you to licensed mental health professionals, such as psychiatrists, psychologists with experience in treating PTSD, finding tips to help you prepare for and get most out of your visit and information about getting help. The Substance Abuse and Mental Health Services Administration has online treatment locator to help you find mental health services in your area. Here are some things that you can do to help yourself while in treatment. Talk with your healthcare provider about the treatment option and follow your treatment plan. Engage in exercise, mindfulness, other activities that help reduce the stress. Try to maintain a routine for meals, exercise, and sleep. Set realistic goals and focus on what you can manage. Spend time with a trusted friend or relative and tell them about things that may trigger symptoms. Expect your symptoms to improve gradually, not immediately. Avoid the drugs and alcohol. How can I help a friend or relative who have PTSD? If you know someone who may experience PTSD, the most important thing you can do is to help that person to get the right diagnosis and treatment. Some people may need to help making an appointment with their healthcare provider. Others may benefit from having someone accompany them to their healthcare visit. If a close friend or relative is diagnosed with PTSD, you can encourage them to follow their treatment plan. If their symptoms do not get better after 6 to 8 weeks, you can encourage them to talk to their healthcare provider. You can also offer emotional support, understanding, and patience. If you want to learn more about PTSD, helping children and adolescents coping with traumatic effect, there are fact sheet information for children and adolescents to respond to treatment event and what family, friend, and trusted adult can do to help, also available in Spanish. Post-traumatic stress disorder, the brochure provides information about the problem, including what is and how you develop PTSD symptoms and treatment, and how to find a professional who can help. Where can I learn about PTSD? What is PTSD? The post-traumatic stress disorder is a disorder that develops in some people who have experienced shocking, scary experience. It is natural to feel afraid during and after treatment. Fear is part of the problem, which body fight and flight response that helps us to respond to potential danger. People may experience a range of reactions after trauma, and most people recover from initial symptoms over time. Those who continue to experience the problem can be diagnosed with this illness. Well, I hope this was a little bit informative. It is crucial that our veteran and other involved in serious accident focus on this lecture in order to help them and orient them to go to take the right health care. End of dictation.